this video, we're going to talk about catheter care, emptying out a catheter bag, and measuring urine output. So for this skill, I have my patient here who has a catheter in place. All right, I'm going to get all of my supplies ready before I start. I have my water, my soap, my washcloths, which you need 2 washcloths for catheter care, and then I have my towel. I also have a bath blanket that I'm going to use just to cover my patient so that they feel they don't feel exposed at all. I'm going to go ahead and raise the bed to my working height, and then I'm going to go ahead and have them check the water temperature to make sure it's the right temperature. She says that feels great, and I'm ready to go. I want everything within reach because once I start, I don't like to take my hand out too many times. So the first thing I'm going to do is I'm going to take my washcloth, I'm going to go ahead and get it wet, and I'm going to put my soap on my washcloth. Okay. Next thing I'm going to do is I'm going to expose the resident just enough that I can see the catheter. So the catheter, whoops, I forgot my barrier. So I'm going to put my barrier down as well. My catheter is inserted in the urethra. It's coming out here and it has a leg strap and is connected to the bed bag. So I have my washcloth here, and I'm going to take my hand, I'm going to pinch the catheter at the urethra and push my hand against the patient's body so I know that I'm not going to pull on that catheter at all. With my other hand, I'm going to take my washcloth and I'm going to go ahead, I'm going to wipe down at least 4 inches. So we say 4 times 4 inches. Each time you pull away, you want to make sure you use a new part of the washcloth. Once that is done, this goes into my plastic bag. Then I can go ahead, this hand's staying right here. I'm not going to reach in and out too many times. I'm going to get my rinse washcloth, and I'm going to do the same thing 4 times 4 inches. I would proceed with peri-care as well after I did catheter care, but this is one separate skill that we're working on. So I go ahead and I dry all of that, take my barrier out, and cover the resident back up. So that is catheter care. Now I'm going to go ahead and I'm going to empty out the catheter bag while I'm in the patient's room anyways. So again, I have everything ready to go so I can leave my patient. I'm right next to my patient. And I'm going to empty out this bag over here. In order to empty out a catheter bag, I'm going to put a barrier down on the ground, and I have my graduate. So my graduate's down here. I also have to have alcohol wipes to clean after I'm done. It's nice to have the bed up when you're doing this so that you don't have anything hitting against this. This is the bed bag that I'm going to use, and I just have water in it, so it's a little hard to see on the video. I'm going to go ahead and I'm going to take this spout out of the bag here. I'm going to lower the bed just a little bit because I don't want to splatter any urine anywhere. For this particular bag, you have to pull down on this white nozzle to let the urine out. Some bags, they have a push button thing. There are a whole bunch of different kinds of bed bags out there that facilities use. I'm going to empty this out completely. The first thing that I'm going to do after I empty it is I'm going to close it, because you don't ever want to forget to close it. Then I'm going to go ahead, I'm going to open up one of my alcohol wipes, and I'm going to clean the end where the urine came out of the catheter. You want to make sure this is really clean because urine just came out of here. You don't want any smell or anything like that going on. Once I have cleaned that end really good, I'm going to use my other alcohol wipe, and I'm just going to clean inside the house where that goes. Then I can put that back into place and use my garbage can. Before I can walk away from this resident to measure this urine output, I have to make sure that the bed is all the way down, locked, and it's safe. Now I can take this and I can measure it. So I'm going to just get a new barrier here, and I'm going to measure the graduate. So on here, when you measure urine output, you have to be down eye level to the graduate. So if you can see on the video here, you want to make sure that it's right on the line, or you will round down if it's in between lines. But this one is right at 400 cc's, 400 cc's, 400 mLs. Once I have measured that and I write down that number, then I can go ahead. I will take this and I'll dump it into the toilet, put it in a plastic bag, take it down to the dirty utility room, disinfect it, put it in a clean plastic bag and bring it back and put it back in the resident's room. So that concludes the skill for catheter care, urine output measurements, and emptying out a catheter bag.